What is it now is how cancer patients receive the radiotherapy. Definitely, it is not a pleasant experience. Even worse, it is widely used for cancer patients, even if it is not enough to kill the tumor cells. That's why we are here. Today, if you want to remember our company with a one sentence, this is your take-home message. VSPharmTech demonstrated its efficacy for human beings by achieving 100% of complete response for head and neck cancers, period. From now on, I'd like to introduce our lead technology VS101 and our company. Our story starts from the fact that in spite of a quite high dose of radiation, radiotherapy is not enough. For example, head and neck cancer patients receive 66 grade of radiation for 6 weeks. It is about 1,300 times of radiation limit for nuclear energy workers. The result is not so good. The real problem is here. Cancers are too clever to avoid the destruction by the chemotherapy, radiotherapy, and other treatments. Adding VS101 to the radiotherapy, it prevents tumor cells from repairing the damages on themselves and also getting the resistance to the treatment. As an anti-cancer treatment, VS101 has several advantages. It makes more effective and safer radiotherapy thanks to a dual mechanism of action and minimize the toxicity. When considering the convenience of patients, it is very easy to use as an oral agent. When it comes to market potential, it has a great potential to be widely used for solid tumors. The most promising point of VS101 is so far, all patients treated with VS101 experience the complete response. It means that after the 7 weeks of treatment of VS101, all tumors gone. It means that tumors decrease to the 0 size. I think that market is growing and emerging. There's no approved radiosensitizer so far, but big players such as Merck in Germany and Johnson & Johnson leads this market. However, we believe VS101 is better than the other radiosensitizer in terms of efficacy, safety, and administration. Unfortunately, Merck stopped their program during the phase 3 clinical trials because there are some issues of toxicity, and also it was not effective in killing the tumor cells. I love my leadership team because they are true innovators with a passion for patients and also great track records in the new drug development in Korea. They know how to develop the assets from the beginning to the regulatory approval. Among our track records, I'm really proud to tell you that VSPharmTech is a promising biotech validated by the Korean government and also big players such as Johnson & Johnson. For example, we had an A+ rating from the Kibo. It means that only top 5% tech companies in Korea could get this rating. And also, we are one of 5 companies in 2023 who had a direct investment from the KBIC, which is the operating fund of funds in Korea. To move forward, we have to complete our clinical trials in the United States. Many big pharmaceuticals waiting for our clinical data for phase 2. To complete this study, we need $40 million. Let's leverage Asian technology and capital to make better cancer therapy for the patient in the world. Thank you.